Hi everyone, welcome back to MD-VOD, where today we're talking about gallbladder disease. First, I want to make a shout out to our friends at webasina.com who aggregate medical wikis and Twitters and blogs and health videos. And be sure to check them out on www.webasina.com. And now I'd like to welcome our guest, Dr. Jason Cohen, the gallbladder expert. Thanks for being here.
Thanks a lot.
Hey, so let's get right into this.
First of all, I just want to say you did that perfectly.
Thank you.
You're welcome. I couldn't have done it.
Make sure to go to webasina.com.
I will. Thank you.
Check this out. It'll probably be there.
Perfect.
Learn about your gallbladder. Hey, so what is our gallbladder? What's the function of it?
So that's a great question. The gallbladder really doesn't have much of an important function in terms of do we need a gallbladder. We don't necessarily need a gallbladder. But it's basically a storage organ. It's a little purse, a little pocketbook where bile, which is made from the liver, bile is used to break down and digest fats, and the gallbladder basically stores it for a little while until a meal is eaten, and then it shoves it out into our intestinal tract, and that's the whole job of the gallbladder.
Mm-hmm. And how big is it?
It's about the size of a little change purse, smaller than my fist. Mm-hmm. And when it's empty, it just sucks down into like an empty balloon, basically.
Mm-hmm. And it sits underneath our liver, so where is that in our belly?
Exactly. So it's right on the liver. It's about here. Sometimes there's some variation, but for the most part, it's right over here in the right upper abdomen, or belly.
And problems with the gallbladder are often associated with gallstones. What are gallstones, and
right.
what causes them?
I don't know.
You don't know?
No. Seriously, so the gallbladder basically is a storage organ, and it stores the bile. And what occasionally happens, for reasons some of them we know, some of them we don't know, is that the balance between what's in the gallbladder gets all out of whack, goes haywire. And for some reason, stones, actual rocks, stones, form within the gallbladder. And those stones could cause a whole different sorts of problems. A ton of the population are walking around with gallstones, never know it, have no symptoms, totally fine. But there's a small percentage of the population who actually have these stones or rocks in our gallbladder under the liver that then could potentially have problems. And I'm not sure if I answered your question.
No, you did. You answered it. And I remember in medical school actually looking at these stones. They look literally like little marbles. They're as big as marbles. I mean, some of them get huge. Right?
Yeah, gallstones are pretty cool. And what's amazing about them is some of them look like jewels, not just marbles. Some of them have really smooth sides and look like some kind of bizarre figure, something that kids would maybe play in a Zelda game or something like that. Whereas some of them are big rock eggs that could be the size of a big giant egg, actually, believe it or not. Some people could have hundreds of stones, some people may have just one giant stone.
So let's. I can imagine. You know, it's up in our right belly area. We develop these stones, these Zelda-like marbles, in this little sack, this little change purse, as you describe, and it gets stuck, right? And then it sort of contracts against this stuck tube. And it causes symptoms, right? So
I don't even have to be here. You're so good at it. You could just tell me exactly what we need to know.
The change purse.
I love that.
And the Zelda game.
Thank you. So. What happens is, again, some people have gallstones would never know it, and they're just sitting around there bobbling around. But a few different things could happen with gallstones. In some people, the classic cholecystitis, or infection or inflammation of the gallbladder, is it kind of one stone or a couple of stones get wedged in that neck of the gallbladder where it's about to empty into the intestinal tract. Those patients that get stuck get super sick, need to go to the hospital, sometimes potentially could be a fatal disease even. Some patients are lucky that they kind of just bounce in and out, kind of like a lotto game machine thing. And those patients who just bobble around will get pain with eating, or just after a big fatty meal, or occasionally even they'll get awakened during sleep with pain. Those are the two most common problems from the gallbladder gallstones. But then there's a whole gamut of stuff that could happen in terms of those stones traveling through into the tubes, into the intestines, that could cause inflammation of the pancreas, something called pancreatitis, which also could range from mild to very severe. And then lastly, they could just get stuck in those tubes that drain the gallbladder that also could range from very mild to very severe. So there's a whole bunch of different diseases that could happen from having gallstones.
So that's a really good point. Gallstones can be problematic, not because your gallbladder is infected or inflamed, at all, because it can get, it's sort of like a bunch of freeways coming together and merging, and they all come into the same spot, the 405 or the 105 and the 101, whatever, get together. And if it gets blocked, you can inflame other organs like the pancreas, which potentially could be deadly.
Could be deadly, exactly.
So who's at risk for cholecystitis or inflammation of your gallbladder?
So in med school, we learned the 4 Fs. What are they?
40, fecund, female, I can't remember.
Right, so fat, female, fertile, what did you say?
I don't know.
I don't know. So there you go. There they are. So fat, female, fertile, and 40. Those are them. And so basically, women tend to have a higher predisposition to gallstones over men. Being in that age range of 40, you generally don't see a teenager or a 20-year-old with gallstones. So generally, once you hit 30s or 40s, you'll tend to start seeing them. Fat, obesity is unfortunately definitely a risk factor towards having gallstones. Interestingly, rapid weight loss is a significant risk factor to developing gallstones also. So an obese patient who says has some kind of either a diet or obesity surgery, significant high risk to developing gallstones.
Interesting. Yeah. So rapid weight loss is another risk factor for inflammation of your gallbladder. So let's say a patient comes to you.
Importantly, families. Often if your mom had gallstones, your dad had gallstones, it wouldn't be surprising if you developed abdominal pain. Hey, you may have gallstones. So that's something definitely to remember.
Yeah, family. Yeah. The other F.
Exactly.
The 5th F. There we go. So
they were a good band. I like them.
We're together here.
Exactly.
Hey, so once someone comes to you with this, right upper quadrant abdominal pain, you have a high suspicion that they have a gallbladder problem. What do you do to diagnose it, to confirm that that's the issue?
So patients present in 2 different ways, either in the hospital or with a severe attack, or they'll present just having these episodic pains after eating fatty meals. The first thing, no matter what, usually we do is an ultrasound of the abdomen, of the belly, the same test that's done for pregnant women to look at the babies, a totally non-invasive test. And that's usually the first thing. It's very good to actually see the presence of gallstones in the gallbladder. And then there are other blood tests that help us decide, are you really sick from it? Do you have that inflammation, the itis part of it, the cholecystitis, or is it just the presence of gallstones? And then also we could check your liver tests that sometimes help us decide, are those stones stuck in those tubes anywhere along the freeway that we need to do certain other things, like get a truck to tow you out of there potentially.
Or a crane.
There you go. Nice.
I got it. So, or the jaws of life.
Right. Or maybe Carmageddon.
There you go. Carmageddon. You're really done.
Yeah.
So once you make the diagnosis, you do the ultrasound, you get the lab tests, then what do you do to treat ultimately the patient with a gallbladder problem?
So once a patient, we know a patient has gallstones, symptomatic, generally the recommendation is surgery. It's unfortunately, it's really a surgical disease that needs to be treated surgically. People always want to ask, are there certain things that you can do medically to prevent or cure gallstones? And for the most part, there are some things that could potentially get the gallstones to maybe shrink a little or dissolve a little. But once a patient starts making gallstones, they're going to keep making gallstones. So the treatment is surgical. Would you like me to expand on the surgical treatment?
Absolutely. We've come a long way
Kennedy?
Since medical school. We had a big, huge scar in the belly. So, yeah, that'd be great.
So in the olden days, it was a big, giant, old-fashioned incision right up and down here, sometimes an up and down one in the middle. And that's old-fashioned surgery. Then kind of with laparoscopy, with scopes and cameras, which really took off in the 1970s because of gynecology, actually. They were the ones to first start, the gynecologists were the ones to first start using laparoscopes. Kind of in the beginning of the 80s, surgeons, actually mid-80s, surgeons started using it for gallbladder disease. And what's fantastic about that is it really doesn't matter if the patient's skinny or fat, no matter what their body habitus is. The surgery is pretty much the same with the scopes and the cameras. It's 4 little holes generally. Sometimes we do it with 3 little holes, one at the belly button, one just below the breastbone over here, and 2 off on the right side. And through those 4 little holes with scopes and cameras and toys and good fun stuff, we're actually able to take out the gallbladder. Knowing anytime we do laparoscopic surgery, one really must tell the patient that there's always that chance that you, the patient, may require conversion to an old-fashioned open incision, depending on certain things that we might find.
And, you know, with any surgery, there are risks. What are typically the risks associated with a laparoscopic cholecystectomy?
So the first risk, as I just said, was possibly needing open surgery. So it's not considered a complication, it's not considered a risk, but it could potentially happen. The other risks are occasionally infection. Anytime anybody has surgery, there's always a chance of infection, whether it's in the skin or deep inside of the belly. There's always a chance of bleeding. Anytime anybody gets cut, there's always a chance of bleeding. And then despite our advancements, being able to do laparoscopic surgery and take these gallbladders out, there's always a potential risk of hurting those highways and freeways, those tubes that drain the gallbladder. They're called ducts. There's always potentially a chance of injuring those, which could potentially turn into a major complication if not identified. Ideally, if it occurs, it's identified and it can be fixed. And most of the time, patients still do okay. But that's one of the bigger complications.
And those risks, Dr. Cohen, account for less than 1%.
Yeah,
Is that right?
yeah. And interestingly, when we first started doing laparoscopic surgery, those risks shot way up. They were doing great open with the old-fashioned incision with those risks being minimal. But when they first started doing with laparoscopic, with scopes and cameras, those risks shot up because it's a new modality. They weren't used to operating that way. The imaging, the scopes weren't as good. But now the risk is really minimal, really minimal.
That's great. Great advice and some great take-home information. Thank you so much. I want to ask everybody to go to MD-VOD, emPOWERme.tv if you missed any of today's show. That was great, a great coverage of the diagnosis, treatment, and risks of gallbladder disease. Thank you so much, Dr. Jason Cohen. And stay tuned because up next, we'll learn ways to prevent gallbladder disease on our Apple a Day. Hi everybody, welcome back to MD-VOD, where today we're talking about gallbladder disease, and we're here with Jason Cohen, Dr. Jason Cohen from Marina del Rey Hospital, to answer our questions. He's a gallbladder surgeon extraordinaire, and we'll take your questions live from Facebook and Twitter now. First question up
is... But before you ask that question, I must correct you. No, go ahead.
Yeah, first up is when you are referred to Dr. Cohen.
There you go. That was one of the things.
Does insurance cover the costs?
That's a great question. The answer is no. No, of course, insurance definitely covers the cost. It's especially in an emergency setting, probably 100% of the cost. Electively, it covers the cost as well. I rarely have heard of any difficulty with a patient having coverage in terms of having a gallbladder, even an elective gallbladder removal surgery. It's pretty much always covered by insurance.
That's important to know.
Right, yeah.
And next up is there are some new technologies out there. One is the Da Vinci robot. This is a great question, which is available at Marina del Rey Hospital. You know, when would you use the Da Vinci robot as opposed to, let's say, laparoscopic cholecystectomy?
That's a fantastic question. So, in terms of technology, we started with before the 70s with old-fashioned open surgery. Then in the late 70s and 80s, we switched to doing things laparoscopically. And the trend has always been to go towards less invasive, smaller incisions, minimally invasive surgery for multiple reasons. Less pain, faster recovery, cosmetics definitely are better with teeny tiny incisions, and it's actually easier to some degree, especially on a giant obese patient with gallstones, to do laparoscopically inside. It's the same as it is on any patient. So it's actually easier for the surgeon to do a laparoscopic scope and camera gallbladder removal rather than an old-fashioned incision. So we keep going further and further along. And one thing that's really nice about the Marina Hospital is they're really embracing technology. And the newest technology is this Da Vinci robotic surgery. And right now, the robot is booming. The use of it is booming. It started off actually for cardiac, for heart surgery. Then it switched over to, well, it's still for heart surgery. Then the gynecologists started using it for deep pelvic surgery. The urologists are using it now for prostate surgery. And the general surgeons and cancer surgeons, which is what I am, a general and cancer surgeon at the Marina Hospital, we've started taking it to the next level. So we've now started taking out the gallbladder. It's really only been within the last 2 to 3 years that removing the gallbladder with the Da Vinci, with the robot, is being done. And one of the benefits of that is the visualization. It's 3D. It's like going to a 3D movie. It's, we don't actually have to wear glasses. We look into this funny little monitor with both of our eyes, and we see it in 3D. The resolution is fantastic, and it really allows us to hopefully do a better job.
And one of the misconceptions about the robot is that it's a robot performing the procedure, but it's actually the surgeon using this incredible technology. It almost looks like a video game. Can you tell us a little bit about what it looks like?
So the way it works is every morning I wake up in my pajamas, I'm laying in bed, they bring me the thing, and while I'm laying in bed, I do the robotic surgery at the Marina Hospital. I wish that were the case. No. So what really happens is we're all there in the room, but theoretically, I wouldn't have to be in the room, but I am there in the room. The robot is actually a tower connected to a bunch of, you don't have a picture of it, connected to a bunch of arms that are robotically controlled, that on the end of those arms have very fine, full 360-degree movements. And the patient's under general anesthesia on the table. We wheel over there or dock this robot. After we've made our incisions, just like a regular laparoscopic surgery, the robotic instruments go in, we set everything up, and then I walk away. I take my gloves and gown off, and I go sit in the room usually. Although, again, you could be somewhere else, and they've done it. But in the room, I go sit down, kind of at a video game monitor, and I'm looking into this big, giant projector here, and I'm playing the video game, basically, Donkey Kong. That means I'm really old if I'm saying Donkey Kong. Wow, I'm ancient to say that.
Pac-Man would be worse.
Yeah, Pac-Man. No, that would be better.
Okay. So that's it?
That's it, robotic surgery. And again, at the Marina Hospital, they've really embraced doing it there. and are trying to push the envelope of what we can do robotically. And one of the benefits of robotic surgery is they keep, the company keeps, and all the companies that are involved in it, keep pushing the limit of what we could do. Smaller instruments, better scopes, better visualization. It's kind of like the movie business a little bit, with the cameras and with what we're actually seeing. And as it gets better, what we can do gets better and more advanced, and it's just fabulous.
So that's a great summary of what this new technology can do, and it's available at Marina del Rey Hospital, which is where you practice. And I liked how you summarized kind of the history of gallbladder disease, how we treat it anyways, with this big open incision that we used to do in the right upper quadrant, to laparoscopic surgery, which is certainly still very important, and now robotic surgery. And as we've advanced, smaller incisions, less pain, decreased length of stay, and a lot of times there's less pain medication requirements. Is that true as well?
Definitely. Thank you.
Just because there's a smaller incision?
So smaller incision, less pain for sure, because one of the things that is the hardest to recover from is recovering from that giant incision. That's where most of the pain comes from. So with laparoscopic surgery, it's a bunch of little holes. That's easier to recover from. We manipulate and deal with and futz with the intestines a lot less, and with the internal organs a lot less. We're really able to just get to where we need to be, take care of the problem, and get out. And one other thing is, I was saying that cosmesis is a big issue also, how things look. One of the pushes now, even with laparoscopic, with taking out gallbladders, where the standard is 4 little holes, the tendency now is to actually do it through 1 little hole at the belly button. It's a slightly bigger hole than the hole we're initially using, but there's no 4 incisions anymore. It's just 1 incision hidden really well at the belly button. And while people are doing it laparoscopically with scopes and cameras by itself, it's a much better operation to be done robotically if you really want to do it that way, because the instrumentation, the scopes, really allow you to do that surgery better. If you're aiming for 1 incision to take out your gallbladder, it really is a better way to do it robotically. And again, the Marina Hospital is really embracing that, which is nice.
And in terms of cost, is there a difference with robotic surgery versus laparoscopic versus open? Is there any difference at all in cost?
At the end of the day, the cost evens out. Up front, though, like starting any business, you're going to have, not to the patient, but to the hospital and to the facility that are doing the technology, it's going to cost more. But as we do more surgery and do more volume of surgeries with the instruments that we have, the cost evens out. And over time, just like any new toy, it costs more, and over time that toy is cheaper.
Well, that's great stuff. I want to thank you very much, Dr. Jason Cohen from Marina del Rey Hospital, telling us about the risk, the treatment, and the therapies available now for gallbladder disease. If you missed any of today's show, make sure to go to emPOWERme.tv, MD-VOD. Today, our whole show was on gallbladder disease. Thank you so much. Take care. We'll see you next time.